Hello and good afternoon. I'm Kaya Lewis from the Department of Health and Human Services, Office of Health Reform, and I want to thank you for joining us today for a web chat with White House Senior Advisor Valerie Jarrett on health reform and underserved communities. Thanks to all of you who have sent in questions online already. We really appreciate it, and we encourage those of you who are joining us on Facebook to continue to send us your questions so we can answer them for you. So without further ado, I'll turn it to Valerie for some opening remarks.
Thank you very much, Kaya, and good afternoon, everyone. We're just delighted that you would join us for this web chat. It's my first time doing a web chat, and so I'm very excited about it. We have been just thrilled by the outpouring of interest, and I'm delighted that our first topic is going to be on the important issue of health insurance reform and how it's going to help us deal with the terrible disparities in health that we see right now across the country. So I welcome your interest. We're just delighted to have everybody on board. I'm going to turn it back to Kaya, who's going to help feed me the questions. We're going to do a combination of those that are coming from you live today, as well as some of those that we've received over the last few days since we announced that we were going to do this web chat. And so without any further ado, let's get going.
Great. So we had a question come in from a viewer from the Black Planet Social Network. And the question is, how will health reform affect minority and non-minority communities who work part-time or less than part-time that aren't covered by employee health insurance or other health insurance covered? What's going to happen to people like me who have no coverage and can't afford it?
Terrific question. And it allows me to really lay the foundation for the very important principles that President Obama set forth when we first began this process towards health insurance reform several months ago. So first of all, and most importantly, those who have insurance currently, who like the insurance they have, they receive it from their employer, they like their doctor, if you are satisfied with what you have the choice to stay with it. The most important issue going forward is, though, how do we protect those who have it but are looking for more stability, and those who do not have insurance who should be covered? Let's remember, we live in the richest country in the world. And for us to have so many uninsured, millions and millions of uninsured in our country is a travesty. And so President Obama's intention, working closely with Congress, is to be able to sign a bill this year that provides affordable, quality coverage to all. Brings down the cost of health insurance. One of the major reasons why people don't have health insurance is because they can't afford health insurance. We want to make sure that if people have a pre-existing condition, something that often happens in minority communities, they're not dropped from their coverage. We want to make sure that your costs don't go up so high that you can't afford it. And for those who are working part-time in small businesses or who are unemployed and do not currently have health insurance, we want to make sure that you're covered. And you will be covered through the very important new system of an exchange. The exchange would be made up of private insurers, and under President Obama's plan, would also have a public option to choose from as well. So everybody in the country, all Americans, would have access to affordable health care going forward.
Great. So we have another question that's been asked by some members of the Asian and Pacific Islander community, which is that the White House has translated a lot of the website materials into Spanish, and they're wondering whether it will, in the future, translate any more materials into Asian languages, such as Mandarin, Cantonese, Punjabi, etc.
Yes, it's an important issue. One of the big challenges, of course, is communication, and we are looking for resources now to make sure that we are able to translate our documents and make them available and accessible to everybody. So we recognize the communication challenge, and we're committed to working on it.
Great. I'm going to take a question that's come in from Facebook. This is from Bill Halstead, and he says that considering the polls are showing strong support for public option, why is there such controversy about it?
Well, that's a really good question. As you know, the president has been a big proponent of the public option since the presidential campaign. And let's take a moment to talk about why we think a public option is a good idea. By having a public option, we believe that that introduces competition into the system. What we have learned is that in states that only have one or two dominant insurance carriers, the costs of insurance are much more expensive than in states where there's competition. And so what we thought made sense is to introduce a public option. And this would be a choice. I think some of the distortion that was in the media around the summer holiday when we had all those town hall meetings was a distortion of what the public option is all about. No one will be forced to take the public option. The word option means choice, and it would be available not to the people who currently have insurance and are satisfied with their insurance, but to people who participate in the exchange. So with that, we believe that the public option will help bring down the costs, it'll enter competition in a certain discipline, and hold the insurance companies' feet to the fire to make sure that once and for all we are able to provide affordable health insurance to all.
Great. We've got a question from Robert. He's Latino, and he has a question about health reform in the Hispanic community. He's saying that health reform needs to pass because the Hispanic community receives poor quality of care and is uninsured. His question is about how we would address immigrants in health reform and what we would do to make sure that health reform would benefit the Latino community.
Well, I'm glad that you raised that issue, Robert, because you're absolutely right. There are definite disparities in healthcare in the Latino community, in the African American community, in the Asian community. In fact, through all minority communities in our country, we're seeing the disparity. And there are many different ways that we would tackle the disparities under health insurance reform. So let's talk about them. So first of all, we need to make sure that there's wide and accessible health care to all. You're right, Latinos are disproportionately covered with health insurance. And it's either because they're working part-time, they may not have a steady job at all, they may be self-employed or work for a small business. So for a myriad of different reasons, they're not fully covered. We need to make sure that they're covered. Secondly, and also importantly, there are a lot of diseases that we find are disproportionately present in minority communities. So with the Latino community, it may be cancer. With the African American community, it might be hypertension. With the Vietnamese community, it might be cervical cancer. So first of all, we need to do a better job of collecting data to figure out which diseases tend to be in certain communities. And then we need to make sure that we're doing everything we can to have people have preventive medicine. Many people don't have regular checkups. In fact, I met with a small business last week, very small business, just a few employees, 7 employees. He told me that 3 of his employees, who are young adults in their 20s, had never been to a doctor. One of them had never been to a dentist, and in fact ended up in an emergency room because he had a tooth abscess, because he'd never had a regular dental checkup. That's a terrible thing. And so what we need to make sure is that people have preventive medicine where they can go into their physician, their primary care physician, on a regular basis and don't end up in the emergency room. Far too many emergency rooms around our country are acting as primary care physicians for our population. And so diseases which would be easily treatable if you went in ahead of time, if you had screening ahead of time, regular checkups on a regular basis throughout the year, these diseases would be detected. Simple procedures such as mammograms and colonoscopies are too often neglected because people can't afford the testing. So as a part of health insurance reform, those kind of obvious screening testings would happen without cost to the insured. So you wouldn't have to pay for those. They would be a part of your package because we want to encourage people to go in on the front end and make sure that you have the kind of testing that you need so that you aren't faced with these terrible diseases that would have been treatable had you gone in earlier.
To that end, you're talking about access to primary care. We've gotten a couple of questions about health professions and the health professions workforce, making sure we have the workforce we need. And so we got a question from Rodriguez, and he's asking about the minority health profession schools. We have minority health profession schools that have trained about 50% of the doctors and dentists, African American doctors and dentists in this country, as well as pharmacists. And so what would health reform do to support the training programs that we have to increase diversity in the health professions?
Well, here we already got to jump on it. In the President's Recovery Act, as well as in his 2010 budget, we have dollars set aside to make sure that we increase the training of healthcare professionals, physicians, physicians' assistants, and nurses. We do not have nearly enough nurses in our country, and we want to make sure that we encourage these new professionals to go into underserved communities, whether they're cities that need these particular primary care specialists or rural areas that are oftentimes unserved as well. So in the President's budget and in the Recovery Act, we have a jump start. We need to do more. We need to go further. But this year alone, actually by the end of 2010, we'll have 8,000 new healthcare professionals that are going to be trained as a result of the Recovery Act. We need to continue that process. We need to encourage young people to consider careers where they're going to give back, where they're going to work in areas that are currently underserved. Every person in our country should have a primary care physician who you go to on a regular basis. That will avoid needless trips to the emergency room. So we want to do what we can in terms of trying to encourage people and provide the resources we need to encourage people, and it could be through scholarships, it could be through grants, it could be funding all kinds of programs, but encouraging people to go into the healthcare field, the primary healthcare field, where they can serve people and prevent the kind of illnesses that become chronic if untreated over time.
Great. I'm going to go back to one of our Facebook viewers. This is Mari Snow, and she's a small business owner. And you talked before about a small business owner you met. She wants to know how small business owners are going to be impacted by health reform.
Well, I don't need to tell you that one of the major challenges of small businesses is to be able to afford health care insurance for their employees. Currently, many small businesses are choosing between adding an additional employee to be able to service their customers or health care. Many small businesses have had to get out of providing health care to their employees. Even though they want to, they simply can't afford to. So small businesses will be given a subsidy to encourage you. And in fact, I should mention at the outset that small businesses were given tax breaks as a part of the Recovery Act, as were the middle class, because we understand that the struggle that you're under each and every day. So very small businesses, their employees will be able to participate in the exchange. And so they'll be able to pool all the people together and have some efficiencies and some economies of scale, and again, bring down the cost of insurance. You know, if you're a very small business, that it costs you far more to provide insurance per person to your employees than a large company. So we want to make those economies of scale work for you. That's what healthcare insurance reform will do.
Great. We got a question from James, who is an American Indian, and he actually heard about the chat from his tribal chairman. And he is wondering how health insurance reform will specifically affect Native Americans who are eligible for direct care through the Indian Health Service. And we also got another question from Indian country about health professionals in rural communities and how we can make sure we're getting care to all the populations in the U.S.
Another good question, and another one where we got a jump start under the Recovery Act and the 2010 budget. So government-to-government relationships between the tribal communities and the U.S. government are very important and have to be supported. And that's why the President has allocated additional resources to help support health care among all of our tribal nations. And I have to make a pitch, because this week, this Thursday, we have invited all of the nation's tribal nation representatives to come to the White House for the first time ever. And health care is one of the most important issues that will be on our topic for that day. In fact, I just left a meeting of the Economic Council, the National Economic Council, and we were talking with many of the cabinet members about all of the different ways that we interface with the tribal nations. And we want to make sure that this Thursday is not just a celebration of everything we do today, but that we make very concrete steps of how we want to move forward. So it'll be a full day in the White House, and we're hoping that many of the people around our country who are leaders in the tribal nations will be with us this Thursday for that important event.
Great. We know that we see distinct health disparities in people with disabilities in the U.S. And so we got a question from Anne in California, and she said she's concerned that health reform will need to ensure that people with disabilities still have affordable and accessible coverage. And so she wants to know, what will health reform do to ensure that people with disabilities will have coverage and better coverage?
Better coverage is right. And so most definitely health insurance reform is designed with people with disabilities in mind. There are people with disabilities who may be covered by Medicare or Medicaid, but they fall within the donut hole that we've been talking so much about. We need to close that gap so that prescription drugs are more readily available and more readily affordable to people with disabilities. Both physical disabilities and mental disabilities are going to be covered under health insurance reform, and that's a very important point as well. Oftentimes people with disabilities are not insured, so we need to make sure that you have affordable health care insurance, whether you're able to work, whether you're able to work part-time or not at all. We want to make sure that you have a safety net that you so definitely deserve by being an American citizen. And so it is with you in mind that we are moving forward with health insurance reform this year.
Excellent. We had another question that was about what health reform will do for people with chronic conditions, considering that minority communities tend to have higher rates of chronic conditions like HIV, for instance. How will health reform help those communities that have high chronic disease rates?
Well, first of all, we need to do a better job of collecting the data, and I mentioned that earlier on in our chat. We need to understand very clearly which diseases we find in which different parts of our country, in which different ethnic groups, where they're concentrated, and that'll help us analyze how to treat the diseases. A lot of chronic illnesses are very treatable if you get preventive care. So conditions such as asthma or hypertension, and now HIV/AIDS. We need to make sure that we are screening. We need to make sure that we have early intervention. We need to make sure that we have regular follow-up visits with the physician. These diseases are not treated with one trip to the doctor's office. They require constant care over time, and the symptoms will be greatly managed if we get that kind of consistent, steady treatment. So our job is to make sure that the health professionals are available out around our country, in cities, in rural communities, in areas that are not densely populated, to make sure that everyone has access to these very important healthcare professionals so that chronic conditions do not become life-threatening. A lot of the diseases I just mentioned can be managed, can be easily managed, but people have to take the time to go to a doctor. We need to make sure that they have affordable prescription drugs to help treat their conditions, and we need to make sure that there's adequate follow-up time and time and time again. That's what health insurance reform will do, and it will give you the resources to have the kind of screening that I mentioned also a little early on, so the conditions that are not acute don't become acute. Many chronic conditions do not need to become acute. And our emergency rooms are filled with chronic conditions that became acute because they weren't properly treated. We want to make sure that you get the treatment that you need.
Great. We got a question from Facebook from Jeanette. And she says, what about the rising costs of healthcare, like hospitals, procedures, tests? She doesn't have insurance, and so she pays her own medical costs. What are we doing about bringing the costs down?
One of the major goals of health insurance reform is to bring down the cost. Right now, families, businesses, and government are spending far too much money on health insurance. We're spending more than any other developed country, and yet the quality of our health care in this country is not what it should be. We want to make sure that your tax dollars that are spent by the government and the private dollars that you spend are being spent as efficiently as we can. There is plenty of waste, fraud, and abuse in the system. We want to make it transparent. When you receive an insurance bill, we want you to be able to understand the bill. When you go to the hospital, we want you to fill out one form, not 10 forms. When you go to a doctor and you have lab tests, when you get referred to another doctor, we don't want you to have the same tests all over again. All of that is just inefficiency in the system, and the dollars that we spend are not going to improve your health. We want to make sure that we incentivize the healthcare system to be designed to provide you the best quality healthcare possible. Not the most number of tests, not the most number of visits to 10 different doctors, but we want you to be healthier at the end of the day. So our entire design is with you in mind. It is to make sure that private and public dollars that are spent are there to deliver quality, affordable health care to you, and that the costs come down. One of my responsibilities is doing outreach to the business community. And over the last 10 months, I haven't met with a single business owner, small, medium, or large, who did not say to me that one of the primary challenges that they have in this economic climate is health care. So it's a challenge for you as a family, it's a challenge for you as a business owner, and it's a challenge for us at the federal government. We need to tackle this, and we need to tackle it this year.
We're having a lively discussion actually online about how healthcare will be paid for.
All right.
People are doubting whether we'll pay for it or not, whether we even ask the question, so I thought I'd ask it.
Well, as you know, President Obama inherited a lot when he came into office. And he's been saying lately that, rather than complaining about the way we're sweeping things up, come in there and help us sweep up the extraordinary mess that he was left. Let me just take a minute to describe to you, since we're coming up on the anniversary of the election, what the president was faced with when he came in the door. 2 wars, a global economic meltdown, where we're just now beginning to fully appreciate how close to the precipice we were, and the president was able to pull us back, working closely with Congress when he passed the Recovery Act, which we've talked about a little bit today, when he was able to stabilize our banking system, not to help Wall Street, but to make sure that money was flowing to Main Street so that companies had the working capital they needed to keep their employees on board. He was faced with a healthcare crisis, which of course is the topic today, an energy crisis where we know we have got to reduce our dependence on foreign oil. We also know that we've got to figure out how to make sure that we are cognizant of the environment in which we live, and that we are sensitive to using up too much energy in our environment. We also have a public education crisis. And frankly, we had a crisis in terms of how the United States was perceived around the world. So upon multiple fronts, the president has been able to move our agenda forward. But one of the items that he also inherited is a $1.3 trillion deficit. And I would pause to mention that when President Clinton left office, he left behind a surplus. So not only did we run through that surplus, but we have also created this huge national deficit. We have to bring the deficit down. And so when the president laid forth his principles for healthcare reform, what he was looking for and what he would require in any bill that he signs, making sure that we do not add to that federal deficit is a requirement of the president's. He will not sign a bill that adds to that deficit. And so please be assured that as we move along through the implementation of health insurance reform, making sure that we find efficiencies within the existing system is foremost on the president's mind.
Great. We talked about disability before, but we had one question come in that was specifically about mental illness and whether health reform would have mental health parity, and what else in health reform would help people with mental illness.
Well, let me restate it again. Both people with physical and mental disabilities will be covered by health insurance reform. We do not distinguish between the two. And so whether it's prescription drugs, whether it's screening, whether it's preventive medicine, or whether it's general care, we want to make sure that those who have mental disabilities are covered by the same safety net as people with physical disabilities or illnesses. So yes, in a word, you will be covered.
Excellent. We had another question about exactly what health reform would do for people from minority communities with high incidence of disease that normally can't get insurance, or people concerned about pre-existing conditions. And I know we touched on it, but I think it's worth
Let's
repeating.
come back, because it's a
people
very,
keep asking.
Thank you. It's
Yeah.
a very important goal and objective of President Obama's health insurance reform, and it's personal for him. President Obama, as many of you have heard, his mother died from cancer. And literally, as she was grappling with her chemotherapy treatment and facing an inevitable death, she had to deal with the fact that she had changed jobs and she wasn't sure if her insurance was going to cover these mounting costs of her health care. Watching his mom go through that devastating experience was really, well, obviously it was a tragic experience for the president, but it really helped him understand how unfair our system is. People who have pre-existing conditions should not be penalized by our health system in our country. And the definition of a pre-existing condition can be ones that would greatly surprise you. I recently learned that in several states, if you have been a victim of domestic violence, that's considered a pre-existing condition. If you have been pregnant, that can be considered a pre-existing condition. And so for a whole host of really irrational reasons, insurance companies can drop your coverage. We want to make sure that that doesn't happen. People in this country who have pre-existing conditions should have health insurance reform. If you become ill, you shouldn't have to worry, but because you become ill, that your insurance company is going to drop your coverage. Or you shouldn't have to worry that your costs are going to escalate to a point where you can't afford your health care. It's just not the kind of country we are. So all of these issues are going to be tackled through health insurance reform, and if you have a pre-existing condition, you will be covered.
So a question that came in online from Candy, and I think it speaks to several issues in health reform, but she's asking, will everyday Americans who have HIV and AIDS be able to still have treatments that are similar to those that are used by wealthier Americans with the same condition?
Absolutely. I mean, one of the underpinnings of healthcare insurance reform is to make sure that people are not discriminated against on the basis of a pre-existing condition, on the basis of race, on the basis of geography, or on the basis of wealth. The whole goal is to make sure that everybody has access to affordable healthcare systems. I want to restate what I said in the beginning. If you have health insurance, if you're happy with the insurance you have, if you like the doctor that you have, of course you may keep everything you have. But if you don't, if you're one of those in the country that has been left out by the system, either because of a condition that you have, because of where you live, because of your income status, because of a disability, you will be captured by our health insurance reform. It's designed for you. It's designed for everybody. Provide stability to those who have it, provide accessible, affordable care to those who don't. And if your circumstances change and you have it, but then you lose your job, you shouldn't have to worry about whether your insurance is going to be dropped in the process. There's a safety net for you.
I think we have time for about 2 more questions.
Okay.
We just got one in from Janice, and she asked, will college-age students have access to some type of health care?
Will college students have access to health care? Sure. Everyone should have access to health care. And the goal is to make sure that we have a system that is that captures everybody. College students who aren't working should have access to health care the same way people who are working part-time, the same way people who are fully employed. The goal is to level the playing field.
And then we got a question online that came in before we started that asked, what is it that we can all do to help pass health reform? We actually got that question. What can we do to help pass health reform?
Well, I think the biggest thing you can do is take the time to really understand the issues that are before us and educate yourself, educate your family, your neighbors, your colleagues at work. Part of the problem that I think we had over the course of the summer is there was a lot of noise and distortion about what healthcare reform was really all about. You guys will remember those town hall meetings. And what we want to be able to do, and part of why we came on today and wanted to have this chat with you, is to provide an open and transparent dialogue. There are issues that we could reasonably disagree on, but I think everyone agrees the goal. The goal is to provide affordable health care for all, to make sure that we bring down the costs, which are escalating at exorbitant rates. They're having an impact on both government, families, and the private sector. We need to make sure that we can contain those costs, make it more efficient, make it serve you. And so engage in that dialogue around your kitchen tables, around the water cooler at work, around the community centers, and talk about the issue. And if you have questions, we are here, we're ready and available to answer your questions. Our whole philosophy is one of transparency. And this has been an extraordinary process, and I would have to hasten to add that we should be mindful of how far we've come. We started down this path several months ago where the president kicked off a town hall here in the White House where he had representatives of hospitals, of nurses unions, of pharmaceutical industry, of the business sector, representatives from the Senate and from the House, from all over our federal, state, and local governments, all gathered together. And his charge that day was, let's move down a path with basic parameters to provide this affordable health care for all that brings down the costs and make sure that pre-existing conditions are covered. And so what we've done along this journey is engage the American people in the dialogue, engage all of the stakeholders, making sure that everyone has a seat at the table, no seat's bigger than another seat, and make sure that we keep the dialogue open. It's been tumultuous at times, it has been challenging at times, it's been raucous at times, but what we believe is that through this process, the American people have had an opportunity to hear what's really at stake. They have had an opportunity to educate themselves, but we still have a ways to go. And the fact that for the first time in literally decades of effort, We have 5 bills that have been passed through all of the relevant committees in both the House and the Senate and are now being debated fully. It shows you just how far we can come if we continue to have an open dialogue. And so we're at the home stretch, but we're not at the finish line yet. And so we need your engagement, we need your involvement, we need you to continue to push us if there are questions that haven't been answered. I'm sure that we're going to have our website up and we'll have this interaction with you over the coming weeks. But it is extremely important that we have this passed and on the President's desk this year. We have waited far too long for health insurance reform. Every day, I believe it's 14,000 Americans who lose their health insurance. We just simply cannot sustain that. Every day, the costs of health insurance go up. When we met with the small businesses last week, they all told us how their insurance premiums are going up double digits in the coming year. That's unsustainable. In a country such as ours, we can do better, and we will do better with your help.
Great. Well, thank you, Valerie. I want to thank all of you for joining us and remind you that you can go to healthreform.gov and also whitehouse.gov to get all the resources you need to understand health reform and also to weigh in and continue to send your questions to us. Thank you for joining us.